Today we'll talk about the impact of climate change on people living with Parkinson's disease. I'm here with Professor Indu Subramanian, and she is a very well-known person in movement disorders. She is the professor of neurology at UCLA, where she directs the Center of Excellence for Parkinson's disease and Veteran Affairs. We know that as climate changes, there will be more frequent and more intense heat waves. And one of the consequences that is often overlooked when we talk about this topic is the impact that this heat stress will have on people living with neurodegenerative disorders. Can you explain us a bit how heat waves can pose a risk for these people, our patients, the people we treat?
Yeah, absolutely. So, I mean, I think that we're seeing the effects of climate change. I just am in LA. We have these fires. You live in Portugal. I mean, I think, even small amounts of heat changes. So there was a study coming out of Spain where just a 1 degree increase above 34 degrees Celsius increased, ER admissions and mortality even by, I think it was like 10% was like sort of the total number of incidents of different things that were increased just by this small change. And so, many people around the world suffering from neurodegenerative disease may not have access to cooling in their homes. I think, many parts of Europe don't have air conditioning, and, the heat can get quite bad in many countries. I think where we're seeing these issues are places where often the temperature is pretty mild or moderate, and then periodically the change can happen, and the patients need to be prepared for that change. They need to stay cool. Parkinson's patients have increased issues with sometimes autonomic issues, and so their blood pressure may fluctuate. They may have changes in sweat mechanisms. They may also have medications such as anticholinergics that change their ability to sweat and cope with heat. And so we really do see these changes in our patients, and many of us are able to get alerts on our phone, but because our patients are sometimes disconnected from these alerts or the usual mechanisms in which people are helped in these sort of crises, I think they're really especially at risk.
Are there among these patients some groups that are particularly vulnerable, and that we should look out during our clinical routine?
Yeah, I mean, I think being proactive is important. I think, in the state of an emergency, we're also helping our families. We just had the fires here in LA. We were so busy trying to make sure the hospital wasn't affected and our own families and evacuating that I think we really, at that time, to start gathering data and information about who might be at risk and then trying to, make lists of who to call, may be very hard pressed to do that at that time. So I think being proactive and where I really came from, my interest with loneliness and who's living, very socially isolated lives, it's really many of our patients. And so I read this book called Project Unlonely. It was a very interesting book. It talks about who dies in a heat wave. And I really was sort of drawn into the fact that many of the patients that are our most beloved patients are elderly patients, often older men who may not be connected and may not know to ask for help or feel comfortable asking for help. Patients who are minoritized, maybe living sort of already on the fringes. So people who are, let's say, language-wise not fitting in, asylum seekers or refugees. In our country here in the United States, African American men are very at risk for this, given some issues with sort of the way that they're sometimes marginalized or not connected in society. And are very isolated. Additionally, people who are sick, so our patients, people who are also have a history of trauma, who may also be at risk for getting isolated. And then people who are on the wrong side of the digital divide, so people who may not have access to a smartphone or a computer. And I think so much of what we do is now virtual, and I think we just have to realize who's not getting served by that and who might be left out. So it's really these sort of populations that are at risk. And so being proactive about, asking questions about loneliness. Do you sometimes or often feel isolated? Do you sometimes or often feel left out? Understanding what the social ties are of that person. Do you live alone? Where do you live? Do you have friends and family that check in on you? Who's in your social network? I think I've been asking these questions more and more, and I realize how few patients really have all of these sorts of good ties. And so sometimes we in the healthcare system or we in clinic are the only people that really are connecting these patients to the rest of society, honestly.
So we sort of need to connect them with the community, break the isolation. Um, and besides that, and I think that probably varies between the countries and the context, how you can better integrate these people. What other advices should we give not only patients, but probably also families and communities? How can we equip them and prepare them for these challenges that will become more and more frequent?
Yeah, I mean, I think it is important. I think often patients feel like they don't matter, right? Like when they age, they get older and they're like, I'm not an important, contributor in society. And so I don't want to be a burden on my family. But I think many of the time, especially in these emergencies, the family wants to make sure they're okay. They can't reach them, the doctors want to make sure they're okay and they can't be reached. So having, a working charged cell phone in these time frames or some person, a neighbor who can check in and be identified who's very local, I think is important. One thing that I had an idea around, and you can tell me what you think about this, Vanessa, is, us keeping lists of the most isolated patients and giving those lists to support groups and having possibly a phone tree of, a support group leader handing, 10, the list divided by 10 to 10 people who can then call those 10 people. And we've reached now 100 people, through a support group mechanism, perhaps a Parkinson's nurse or social worker. These sorts of folks may also be engaged at a time of emergency. We can kind of trigger that. And if we know, sometimes we can predict, for example, a heat wave is coming the week before, making sure that we have the right phone numbers. We're able to contact Mr. Smith, for example, and that, 2 days before that we check in with Mr. Smith and make sure that he has, access to air conditioning or a cooling place that they like here, the mall or the library or a school might be set up, to bring people who don't have air conditioning, who might be at risk. Make sure Mr. Smith has a neighbor that's looking in on him, that he has clean water, and food, enough medications, things like that. Let's say that, with some of these issues, the power goes out, and then we don't have light or, ways to even use, computers and things like that, charge phones. So making sure that, we have a backup power supply and, also that we have a sense of the day of that Mr. Smith knows that if he's feeling dizzy or there's, important to keep drinking water, stay out of the midday sun, stay in a cool place. If he's starting to not have good urine output or not feeling well, feeling, that he has a number to call where he can, get the right care that he needs. So, because ER visits often at that time are very overwhelmed and, trying to just get the help, calling an ambulance may not work. So maybe a neighbor could take him into the clinic or something like that. So, just planning, I think, in general at our visit, keeping lists, making sure the family knows to check on their loved one in times of emergency, that there are increasing heat waves and things like that, a neighbor that's identified, and then the week of, I think in our paper that we wrote in JAMA Neurology, we outlined sort of a plan of, what can be done proactively.
Thank you. Yeah, I think one thing you said is, I think it's crucial to also educate the patient, right? Because I think probably many of them are aware of the danger of heat waves, but they are not aware of the dimension of the impact that it can have on them. So I think also education is crucial, both for the patient, for their families. Probably the PD nurse, for instance, where I work in Lisbon, we don't have that many PD nurses. And I think it's even more difficult in other areas of the country, but social workers or even city councils, perhaps organizing something with the city council or even with the help of the patients' organizations, because then you can create a tighter network. Especially because then it's probably a bit easier to include also people who live on the fringe. I'm just thinking out loud, because sometimes it's very difficult to reach out to some of these patients, right? That's sometimes my impression. But you're
Absolutely.
absolutely correct.
Yeah, I think, having postcards maybe, please include your phone number, updated phone numbers and send it in to a, support group or, PD support organization, as you mentioned, or even the clinic. I think we rely so much on internet and digital, networking, that these patients are not getting, really. I mean, I know with the fires, for example, it required law enforcement to literally knock on the door to say you must leave the house. They weren't seeing all the TV alerts or anything like that. And so as we get more and more fancy with our alert systems, I think we have to realize that, our neighbor may not be getting those. So I think just, I've been really intentional since the pandemic of connecting with my neighbors and knocking on doors and saying, hello, my name is so and so, and I live over here. And, if you need anything, let me know. It's kind of a beautiful way to, I think, feel more connected even for us, in our own communities.
So thank you, Yundu, for sharing your thoughts on this with us. It has been a privilege, and gave me something to think about and also to implement in my practice. I think we have a lot of work ahead of us to tackle this issue as a community. Are there any take-home messages you would like to add?
I think we've talked about the impact of loneliness, and loneliness affects, pretty much everything across the board, mental health, motor symptoms, and quality of life tremendously in Parkinson's. And this was something I never really thought about until the effects that I felt in the pandemic. And I think that, people don't want to be a burden. They don't want to be alone and be a problem for society, right? So they often isolate, but then, once we find them, they're very sick, or, you hear about somebody passing away in a building and nobody ever saw him. And that's so sad, So I think the human, experience is hopefully built on love and connection and spreading sort of a community. And I think we as healthcare providers, it's a way for us also to give back to a community in a different way. And I think many of us feel very passionate about climate change and being able to advocate for these issues, globally. And I think, just in our own, day-to-day life, we can make an impact. And I do think that teaching about how important this is for our communities is so important, even on an advocacy level, for people to understand who are making, the sort of policies and things, that this is a major issue and it's going to become a major issue. And we in healthcare have to own that, that this, it affects, 1 degree of climate change, which, is slated to happen in the next, couple of decades, could impact disease processes so much, not just in parts of the world that are already affected by heat, near the equator, but even places that are far away from the equator, that are being affected by, these sorts of things. So I think we just have to be, come together, even in our society at the MDS, maybe, and talk a little bit more. I'm excited to hear what maybe other people think about this topic, and if there are other topics around climate change that our MDS membership and leaders are sort of inspired by, and challenged with. I think we can come together and talk about that. So look forward to more conversations.